knock on the door and wait for the patient's response to tell me that I can come in. Once I've entered the room, I would use hand sanitizer. Hi, my name is Hillary Jordan. I'm a student nurse at the University of South Alabama, and I'm here today to do your neurological assessment, if that's okay with you.
Yes.
So I will start off with your appearance. I say that she's sitting upright. Her grooming and hygiene is in good condition. And now we're going to move on to behavior. She seems calm. Her speech is clear. Have you had any issues with depression or anxiety?
No.
If I thought otherwise or she had said yes, I would use other screening tools to investigate further. So now we're going to move on to cognition. So can you tell me your name?
Morgan.
Where are you right now?
Home.
Okay, and what time of day is it?
9.
Alright, so we're going to check your recent memory. What did you have for lunch today?
A sandwich.
And I can confirm that because I did have lunch with her. Okay, and so for your remote memory, can you tell me who was the president before Donald Trump?
Obama.
Okay, good. So now we're going to move on to your thought process. So we're going to check your abstract first. So can you explain to me what the saying "needle in a haystack" means to you?
Finding something small.
Okay, good. So next we're going to move on to judgment. So can you tell me where you're going to be in a couple years?
Graduating high school.
Okay, good. So now that we're done with this portion, we're going to move on to cranial nerves. We're going to start with cranial nerve number 1, which is the olfactory. So I'm going to ask you to close one nostril and sniff. Close the other nostril and sniff. So we're checking for patency with this, and she does seem to be clear. So I'm going to ask you to close your eyes and cover one nostril for me. I'm going to get you to identify the smell, okay?
Chocolate.
Okay, good. Can you do the other nostril for me, please?
Hand sanitizer.
Okay, good job. So next we're going to move on to cranial nerve number 2, which is the optic nerve. Normally we would have a Snellen eye chart, which I would get you to stand 20 feet away from and read the lowest number. But because we're in unlimited space today, I'm going to use my handheld vision screener. So this is supposed to be about 14 inches away from your face, which is about 2 flips of the chart. Can you read to me the lowest line possible?
9, 3, 7, 8, 2, 6.
Okay, and so that is going to be 20 over 25, which means that at 20 feet you can see what most people will see at 25, which is close to a normal, the normal being 20 over 20. Okay, so that was going to mean that cranial nerve number 2 is intact. I'm not sure if I said it, but cranial nerve number 1 was intact as well. We're going to move on to cranial nerve number 3, which is your oculomotor, cranial nerve number 4, which is your trochlear, and cranial nerve number 6, which is abducens. So the first thing I'm going to check is your pupils. I'm going to check that they're equal, round, and the diameter of them, which is 4. Okay. I'm going to also check and see if they're reactive to light. So the first thing I'm going to check is if the direct reaction to light. I'm going to shine this in your left eye and see if it constricts, which it does. The next thing I'm going to check is going to be consensual. So what that means is that when I shine the light in your left eye, your right eye should constrict as well. Okay, good. They both constricted. The next thing we're going to check for is accommodation. So if you would look at something on that shelf over there, okay, when I tell you when to look at the pen light, okay, go ahead and look. Okay, good. So her eyes did accommodate, which means that when she looked far away, her eyes dilated, and when she looked at the object that was closer to her, not her eyes, but her pupils constricted. Okay, so we're going to check your convergence. So I'm going to get you just to follow the pen light for me, okay? Her eyes did converge on their axis, which is good. We're going to check your ELM, which is the 6 fields of gaze. So just follow the pen light for me. Okay, good. Okay, cranial nerve number 3, 4, and 6 are intact. We're going to move on to cranial nerve number 5, which is your trigeminal nerve. So I'm going to check the motor portion first, so if you would clench your jaw for me, please. Okay, good. Now I'm going to pull down on your chin and don't let me open your mouth, okay? Alright, so the motor portion of cranial nerve number 5 is intact. We're going to move on to the sensory portion. So you're going to close your eyes for me. Whenever you feel me touch your face, just say now, okay?
No. 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 No.
Okay, so the sensory portion of cranial nerve number 5 is intact, which means that cranial nerve number 5 is intact. So we're going to move on to cranial nerve number 7, which is your facial nerve. So I'm going to get you to make some faces for me, so you can just copy what I do. So smile, frown, pull out your cheeks, raise your eyebrows. Okay, good. So I'm going to also check, I want you to close your eyes tight and don't let me open them. Alrighty, so the motor portion of cranial nerve number 7 is intact. We're going to move on to the sensory portion. So normally for this, I would put something bitter, sweet, or sour on the anterior 2/3 of your tongue. We're going to skip that portion today because I don't have anything with me. So we're going to say that cranial nerve number 7 is intact. We're going to move on to cranial nerve number 8, which is the acoustic nerve. I'm going to check, we're going to start with a whisper test. So, yes. One ear and just tell me what you hear, please.
Purple.
Okay, can you close the other ear for me?
Red.
Okay, so there is no high frequency hearing loss, which means that cranial nerve number 8 is intact. So we're going to move on to cranial nerve number 9, which is your glossopharyngeal, and cranial nerve number 10, which is your vagus. So I'm going to get you to say "ah" for me. Okay. So the uvula did rise on phonation and it is in midline. Normally I'd also use a tongue depressor and go towards the back of the throat to elicit gag reflex, but for today we're going to skip that. So we're going to say that the motor portion of cranial nerve number 9 and 10 are intact. Now for the sensory portion of these cranial nerves, we will normally place something sweet, salty, or bitter on the posterior 1/3 of the tongue, but we're going to skip that part as well today and just say that cranial nerve 9 and 10 are intact. Cranial nerve number 11, which is the spinal accessory nerve. In order to check this one, I'm going to ask you to turn your head against my palm, please. Okay, and do the same for this one. I'm going to ask you to lift your shoulders against my hands. Okay, good. So she was able to turn her head and elevate her shoulders against resistance, which means that cranial nerve number 11 is intact. So we're going to move on to cranial nerve number 12, which is the hypoglossal nerve. For this one, I'm going to inspect your tongue. Okay, it seems to be midline. I'm going to ask you to say light, tight, and dynamite.
Light, tight, dynamite.
Okay, so her tongue's midline and she's able to clearly state these words, which means that cranial nerve number 12 is intact. So we're going to move on to your cerebellar function. So if you stand up for me, please, and go towards the back door. Okay, can you just walk normally towards me, please? Okay, good. And if you would go heel to toe, walking back. Okay, thank you. If you come back towards me. So her gait was smooth and rhythmical. There was no swaying, which is what you want when testing this. So if you would turn around for me, feet together and hands at your side. We're going to close your eyes for 20 seconds, okay? I'm going to be behind you in case anything happens. You would do this for 20 seconds. Okay, you're good. So we would normally say that this is a negative Rumberg test, which means there's no swaying or loss of balance. Now, if you would sit back down for the next portion for me, we are going to do the sensation test. So this is going to be sharp, and this is going to be dull. Okay, so close your eyes for me and tell me what you feel.
Sharp. Dull. Sharp. Dull.
Okay, so sensation is intact. So the next thing we're going to check is going to be your deep tendon reflexes. So we're going to start off with your biceps. So I wasn't able to elicit a response for this one, but that's okay. We're going to move on to your triceps. So I'm going to look for the tendon in her arm. Okay, make sure that I'm holding it up, okay? Okay, so I was able to elicit a response on the second chapter of your triceps, which is good. So we're going to do the brachioradialis this time. So put your hands together for me. Okay. And let me hold up your hands. As you can see, I'm holding up her hands. Okay, I didn't elicit a response for this one either. So we're going to move on to the patellar. So if you could dangle your feet for me. Okay, I did elicit a response for the patellar, and we're going to move on to your Achilles. Okay, I didn't elicit a response for the Achilles either, so I'm going to say about a +1 for her deep tendon reflexes because I couldn't elicit a response for everything. A +2 is what's considered normal. So I'm going to move on to the Babinski reflex. which is a superficial reflex. So, okay, so her toes curled, which is a negative sign for the Babinski, which is what you want. So overall, while doing this assessment, I was also doing the Glasgow Coma scale, which we use to establish your level of consciousness. The minimum you can get on this is a 3 and the max is a 15. If you score below a 7, this means that a coma is present. So in your case, I would say that you scored a 15. The scales all start at 1. For eye opening, it goes up to 4, which is what I gave you. For verbal responses, it goes up to 5, which is also what you scored. And then for motor response, it goes up to 6, which is also what you got, for a total of 15. And that's going to be it today for my neurological assessment.